we are live today from Sakra World Hospital, Bangalore. Here we have with us our expert Dr. Lopamudra Pradhan as a consultant of Obstetrics and Gynaecology to discuss all your queries on small for gestational age. Good afternoon, ma'am. Welcome to our live program.
Thank you.
Doctor, here are a few questions from our viewers. Shall we start now?
Yes, please.
What does it mean for a baby to be classified as small for gestational age?
Small for gestational age means that the baby is not growing well inside the womb. That means that it is smaller than what it is expected for that period of gestation. And the weight of the baby is 10th percentile for that period of gestation.
Okay. What is fetal growth restriction?
So fetal growth restriction, I'll come to that. So usually approximately 70% of small for gestational babies are constitutionally small. That means that they are born small, but they are usually healthy. They don't have health complications. But the remaining 30% of small for gestational babies, they are growth restricted and they usually have some health problems, and this is usually because of some underlying pathological condition. So this is the condition when it is called as fetal growth restriction or intrauterine growth retardation.
What are the common causes and risk factors associated with intrauterine growth restriction leading to SGA babies?
There are many causes. It could be a placental cause where the placenta is not growing well and thus the baby is not receiving enough nutrients and oxygen. That is when the growth of the baby can be small. Also, when the previous pregnancy have had smaller babies or stillbirth, that is baby dying inside the womb, if there is a history of anything of that sort. And there can be certain medical conditions because of which, maternal causes because of which it can happen, like if the mother is having high blood pressure, hypertension developed during pregnancy, which is known as preeclampsia, or she already had a pre-existing hypertension, mother having diabetes, any heart disease, any kidney problems, any autoimmune conditions like antiphospholipid antibody or SLEs. If the mother had excessive bleeding during the current pregnancy, or if the mother is severely anemic, that is the hemoglobin is severely low. It also depends on the mother's age. When the mother is too young, like less than 16 years of age or more than 35 years of age, that is when these are certain conditions where small babies can be smaller. There are certain fetal causes as well. When there is any genetic problems associated with the fetus, like Down syndrome, or when there is some chromosomal abnormality, Down syndrome or other trisomies, there are many other genetic syndromes also which are associated. And apart from that, if there is any maternal infection which can cross the placenta and cause infection in the baby and thus leading to growth restriction in the fetus, like torch infection, or it can be associated with HIV, syphilis, varicella, that is chickenpox. So these are certain infections which can also lead to fetal growth restriction. Or if there is multifetal gestation, that is when there is more than one fetus in that pregnancy, like twin pregnancy, triplet, and so on and on. So these are certain conditions, placental, maternal and fetal conditions, because of which the babies can be smaller.
Okay. The next question is, can lifestyle factors during pregnancy influence the risk of having a baby classified as small for gestational age?
Yes, in certain conditions, lifestyle factors also affect, like excessive smoking, alcohol, or cocaine use, or any other recreational drug use. If the pre-pregnancy weight of the mother, that is the BMI, is less than 20 or more than 25, if not having a healthy balanced diet, not having fruits pre-pregnancy, that is also a recognized risk factor. And also if there is not adequate weight gain during pregnancy, these are certain lifestyle factors which can affect the baby's growth.
Okay. What are the potential short-term and long-term health implications for babies born small for gestational age, and how might it affect their development?
So Constitutionally small babies usually have good prognosis and they usually don't have any health problems. But growth restricted babies, they do have short-term and long-term complications. Like short-term complications like breathing problems during the delivery or after delivery. We call it as respiratory distress or perinatal asphyxia. There can be problems with maintaining the blood glucose. There can be lower blood glucose in the baby. That we call it as hypoglycemia. There can be problems keeping the baby warm, that is hypothermia. There can be reduced calcium, hypocalcemia. There can be jaundice in the baby. There can be feeding difficulties, feeding intolerance. Baby may be more prone for infection, that is, baby will be having less resistance to infection. And in certain cases, when it is not adequately monitored and not delivered at the right time, there can be there can be stillbirth, that is dying of the baby inside the womb or after birth. So these are certain short-term complications. Long-term complications like baby can go on to have diabetes, high blood pressure, heart problems, and learning disabilities, behavioral problems, low intelligence. So these are certain long-term complications. Having said that, it is important to note that not all babies will be having these complications.
Okay. How is small for gestational age diagnosed during pregnancy, and what are the key indicator or measurement used by healthcare professionals?
Okay. So usually when a patient comes to visits during the initial antenatal period, initial pregnancy visits, there is a risk, the risk has to be assessed by checking on the risk factors which are present for that pregnancy and in the woman. Once the risk is usually there is a first trimester marker which is if it is very low, there is low level of PAP-A, or there is a Doppler test which we do, which we call it as uterine artery Doppler, which checks the blood flow through the blood vessels of the uterus. So if that is abnormal, around 20 to 24 weeks, there is a chance that there can be growth retardation in the pregnancy, in that particular pregnancy. So we have to follow up, or we have to we have to keep the pregnancy, we have to be very vigilant throughout and check for the fetal growth throughout the pregnancy. So this is how we assess the risk, and then we with every antenatal visit, when the patient comes to us, we have to examine her, check the fundal height, that is the height of the uterus. If there is any suspicion that there is lag of the growth of the baby, then we go on to have an ultrasound. In ultrasound, we usually actually the growth of the baby is estimated by checking the weight of the baby. If the estimated fetal weight comes less than 10 centile, then the fetal growth restriction is diagnosed. Now, once it is diagnosed, we also may need to do further tests to find out what could be the cause of this. For example, if there is very early growth restriction in a very early stage of pregnancy and it is a very severe, then sometimes if we have suspicion of any genetic problems in the baby, chromosomal problem, that time we go ahead and doing invasive testing, that is amniocentesis, to find out if there is any genetic problems. We may also do certain tests to rule out any infections which can lead to this fetal growth restriction. So these are certain things which we do in order to diagnose fetal growth restriction.
What are the available treatment options or inventions for managing small for gestational age, and how does the approach differ based on the undelivering causes?
So it is fetal growth restriction cannot be treated, but yes, it can be managed, it can be monitored for the till the baby is delivered safely. So first of all, we monitor the whole throughout the pregnancy. There will be surveillance throughout the pregnancy. So there should be regular antenatal checkups, and it will be frequent antenatal checkups as compared to a healthy pregnancy. The second would be we would be doing regular ultrasound, okay, for to check many things. First is to check the growth of the baby. If the growth is if there is growth of the baby, then second is to check for a Doppler. Doppler test is nothing but to check the blood flow through the blood vessels of the fetus or the baby, through the umbilical cord, through its liver, and through its brain. And depending on this Doppler test, it gives us a lot of information. It helps us in deciding the next follow-up of the patient, whether they need follow-up at a shorter interval, or it'll help us in deciding weekly or 2 weekly follow-up. Okay? And it will also help us in deciding the mode of delivery, whether it can be a vaginal birth or whether the patient requires cesarean section. It will also help us in deciding the time of delivery, when should the baby be delivered, in order to prevent any complications in the baby. So that we also do. The other thing is we check for the amniotic fluid in the ultrasound, because growth restricted babies tends to have lower amniotic fluid. We also check for the overall fetal well-being. We call it as biophysical profile, where the breathing of the baby, the movements of the baby, everything will be checked with that. There is also another test which is called as cardiotocography or non-stress test, which we do to check the baby's tracing of the baby's heartbeat. So these are certain tests which we do in order to monitor the baby's well-being throughout the pregnancy.
How does small for gestational age impact delivery and postnatal care, and what support is available for parents of SGA babies?
So the mode of delivery usually is decided based on the growth of the baby and also what are the complications. If the baby, if there is growth of the baby and the Doppler is normal and there are no other complications in the pregnancy, the fluid is also normal, no other complications, then a vaginal birth may be possible. If the growth is very much reduced, or if there is severely growth restricted and the Doppler values are grossly abnormal, then a cesarean section may be recommended to the patient. Coming to the timing of delivery, if there is growth of the baby plus the Doppler values are normal, then we can deliver after the baby's term, that is after 37 weeks period of gestation. It can be decided when to deliver based on the presence of any other complications in that pregnancy. But if due to abnormal Doppler, if a preterm delivery is planned, that is, if the delivery is planned before 37 weeks, then there are certain additional treatment which is given to the mother in order to reduce the prematurity complications in the baby, like giving injections to for the lung maturity, for improving the lung maturity of the baby. There are also certain injections which are given for neuroprotection, for protecting any harm to the brain of the baby, especially when we plan for delivery before 32 weeks. So these are certain medications which are supposed to be given, and also make sure that the delivery should be done ideally at a tertiary care center where NICU facilities, that is neonatal ICU facilities, are available, so that proper postnatal care can be taken for these babies.
My last question is, are there any measures for prevention of SGA or reduce the complications associated with SGA?
Not all conditions can be prevented. Not all conditions which are associated with small for gestation can be prevented. But there are certain lifestyle measures which can be taken, which can help in definitely reducing the complications of SGA. One is to quit smoking alcohol or cocaine, and also to maintain a healthy, nutritious diet, and to maintain a normal BMI, and to come for regular antenatal health checkups in order to diagnose when the fetal growth restriction sets in, and then take adequate steps or treatment. And also to take the medications prescribed by the obstetrician regularly in certain cases of if the patient has any health conditions like high blood pressure or diabetes or any other such condition, so that the complications for the SGA does not increase. So these are certain preventive measures which can help in reducing the complications.
Okay. Thank you, doctor. So with this, we come to an end of today's live show. Thank you, doctor, for your valuable insights. Thank you viewers for joining us. If you have any queries, you can leave a comment. Our expert will answer them for.
Thank you.